Come with me as we splint a fracture on a leg of this cute little green cheek conure. He presented acutely non-weight bearing on his right leg, and he did have a leg band on the leg, so we suspect he got that band stuck in something, and in attempt to pull out his foot, he snapped his bone. So as you can see in the x-ray here, he has a fracture of the bone called the tibiotarsus, which is essentially the main long bone of a bird's lower leg. It's different than mammals, but functionally similar to the tibia, which is the shin bone in a mammal. And so since he is a small bird, under 100 grams, external coaptation or splinting actually works pretty well for fractures like this that are closed and fractures of the tibiotarsus. So we decided to get everything ready to splint his leg. First, we're removing that leg band. This usually is done with either cutting or opening up with pliers, essentially. And here we're placing the tape in multiple layers. I have put him under so that we can relax the leg and, of course, reduce pain. And this way we are able to reduce the fracture and place it in the correct position. And here we're putting multiple layers of tape, but also allowing the leg to stay in a somewhat perched position so that when he is putting weight on it, he's putting it in the correct alignment. And so here we're tightening down the opposite ends of the adhesive, cutting so that we reduce the size of this tape splint, and then afterwards I'll put some kind of surgical glue along the sides just to keep things in place. And then once we finished placing the part of the splint that keeps the fracture together, we got an x-ray to confirm that everything was aligned. And this is him waking up with these distracting tape tabs on there to distract him from chewing the actual splint and just to chew those pieces of tape instead. And as you can see, he already started putting some light weight on the foot in the correct position, and he'll have to stay like this for several weeks until a recheck x-ray, at which point we can see if healing has occurred. So he's getting used to the splint, but he's being kept in a hospital cage at home on pain medications, and he's eating and drinking well.